Today we will discuss about laxatives. Laxatives are medicines or ingredients that are used to relieve constipation. First we will discuss that what is the constipation, what are the reasons for constipation and which medicine we can use to relieve constipation and how we can modify our lifestyle to relieve constipation. First of all, we will explain that what is constipation. Constipation is a common GIT tract problem that affects millions of people worldwide. It refers to infrequent, difficult or painful bowel movements, often accompanied by a feeling of incomplete evacuation. While constipation is typically a temporary condition, it can become chronic in some individuals. How to treat constipation? A variety of treatment options are available, with laxatives being a commonly used solution. However, lifestyle modification and preventive measures can be even more effective in managing and preventing constipation. In this video, I will explain about the laxatives, their types, uses and side effects, as well as lifestyle changes to improve bowel movements. Before discussing in laxatives, it is important to understand that what causes constipation. Various factors can give rise to constipation, including low fiber intake. Fiber helps increase stool bulk and promotes regular bowel movements. And insufficient water intake can also cause dehydration, and dehydration can make stool hard and difficult to pass. And the lack of physical activity is also a reason for constipation. Exercise stimulates the muscles of the digestive tract, promoting regular bowel movements, and some medications also promote constipation. Certain drugs, such as painkillers, antidepressants, and iron supplements, can lead to constipation. Stress is also a factor that can be a reason to constipation. Psychological stress can affect the GIT system and cause temporary constipation. Some medical conditions, such as irritable bowel syndrome, diabetes, and hypothyroidism, can contribute to constipation. And how to treat constipation? There are some laxatives. They are substances or medicines that can assist or relieve constipation by promoting bowel movements. They can be effective in the short term. They should generally be used sparingly and as a last option, as overuse can lead to dependency of the disease. Now we will discuss about the types of laxatives. There are many types of laxatives, each working in certain ways to relieve constipation. First of all, we will discuss about bulk forming laxatives. Bulk forming laxatives are the most commonly recommended type and are often considered the safest for long-term use. They work by absorbing water into the stool, making it bulkier and easier to pass. What are the common ingredients of bulk forming laxatives? Common ingredients are psyllium, methyl cellulose, and polycarboxyl, and they work by increasing the water content and size of stool, stimulating peristalsis, which is the movement of bowel, and facilitating the passage of stool. And what are the uses of bulk forming laxatives? They are ideal for chronic constipation, especially when used by low fiber intake. And what are the side effects of bulk forming laxatives? They can increase bloating, gas, and stomach cramps. If not taken with sufficient water, they can worsen constipation. Now we will discuss the second type of laxative, which is osmotic laxatives. Osmotic laxatives produce effect by drawing water or fluid into the colon. It softens the stool and make it easier to pass. They are generally recommended for short-term use. And common ingredients are lactulose, polyethylene glycol, and magnesium hydroxide. These laxatives increase the water content in the intestine, softening the stool and stimulating bowel movement. They are commonly used for chronic constipation, especially in those who need a gentler, more gradual effect. What are the side effects of these laxatives? They can cause dehydration, electrolyte imbalances, bloating, and abdominal discomfort. Long term use can affect kidney function and in some individuals. Now we will discuss the third type of laxative, stimulant laxatives. Stimulant laxatives stimulate the muscles of the intestine to promote bowel movement. They are often used when other forms of laxatives fail to provide relief. The common ingredients are bicasodil and senna. These laxatives directly stimulate the bowel muscles, promoting peristalsis. They are effective for occasional constipation, especially in individuals who need quick relief. Their side effects are cramping, diarrhea, dehydration, and potential dependency if used regularly. No, there is a third type of laxative known as lubricant laxatives. Lubricant laxatives work by coating the stool and the intestinal walls, making it easier for stool to pass through the digestive tract. Their ingredient is mineral oil. Lubricants lubricate the stool, helping it slide through the colon more easily. They are often used for people who should avoid straining, such as those recovering from surgery or childbirth. They also have some side effects. Long term use can impair the absorption of fat soluble vitamins A, D, E, and K and may lead to liver pneumonia if aspirated into the lungs. Mineral oil should not be used collectively with bulk forming laxatives. Now we will discuss the fifth type of laxatives, which is saline laxatives. Saline laxatives draw water into the bowel using salts, stimulating bowel movements. They are typically used for occasional or acute constipation. Their common ingredients are magnesium citrate and magnesium sulfate. They work by increasing water content in the intestine, softening the stool, and promoting bowel movements. Effective for fast acting relief of constipation, especially before medical procedures like colonoscopies. They also have some side effects such as electrolyte imbalances, dehydration, and bloating. They should be avoided in people with kidney disease or heart condition due to the risk of electrolyte imbalances. Now we will discuss that how to treat constipation by lifestyle modification. In addition to using laxatives, lifestyle modification are very important in both treating and preventing constipation. Here are some tips that I will share with you. First of all, you have to increase your fiber intake. Fiber is essential for good digestive health. It adds bulk to stool and helps it move through the intestine more efficiently. Food rich in fiber include whole grains, fruits, vegetables, and legumes. The recommended fiber intake per day is about 25 grams for women and 38 grams for men. Gradually increase your fiber intake to prevent gas and bloating. Second tip is to drink plenty of water. Hydration is vital for softening stool and preventing constipation. Drink at least 8 glasses of water a day. If you are physically active or living in a hot climate, you may need more. Third tip is to exercise regularly. Regular exercise stimulates the muscles in the intestine, which can help prevent constipation. Aim for at least 30 minutes of moderate exercise most day of the week, such as walking, jogging, or yoga. Fourth tip is that develop healthy bathroom habits. Don't ignore the urge. Respond to the body's natural urge to have a bowel movement. If you will ignore the urge, it can result in constipation. And set a routine. Try to have a bowel movement at the same time every day. This can help regulate your digestive system. The last tip is to reduce stress. Stress can impact digestion, leading to constipation or other GIT issues. Practice relaxation techniques such as deep breathing, meditation, or yoga to reduce stress. In this video, we have discussed about the laxatives, their types, their ingredients, their uses, and some of their side effects, and the healthy tips and lifestyle to manage constipation. While laxatives are an effective short term solution for constipation, they should not be the primary treatment method. Incorporating fiber rich foods, staying hydrated, exercising regularly, and managing stress are essential components of a healthy digestive system. If constipation persists despite lifestyle changes, you should have to consult a healthcare professional. He will rule out any underlying medical conditions. By adopting these preventing measures that I have discussed in this video, you can definitely reduce your risk of chronic constipation and improve overall digestive health.